NS, normal saline. NSR, normal sinus rhythm. NTG, nitroglycerin. NV, nausea and vomiting. NVD, nausea, vomiting, and diarrhea. O2, oxygen. OB, obstetrics. OBS, organic brain syndrome. OD, overdose, right eye, optical density, outside diameter, and doctor of optometry. OP, outpatient. OPA, oropharyngeal airway. OR, operating room. OS, left eye. OU, both eyes. OZ, ounce. Overscore P, after. PC, after meals. PCO2, partial pressure of carbon dioxide. PDR, physician's desk reference. PE, pulmonary embolism, physical examination. PEARL or PERL, pupils equal and reactive to light. PEARLA, pupils equal and reactive to light and accommodation. PEARRL, pupils equal and round, regular in size, react to light. PED or PEDS, pediatric. PEEP, PEEP, positive end expiratory pressure. PERRL, pupils equal, round, and reactive to light. PID, pelvic inflammatory disease. PMH, past medical history. PND, paroxysmal nocturnal dyspnea. PO, per os, or by mouth. PO, postoperative or post-op. PRN, pro re nata, or as needed. PSI, pounds per square inch. PSVT, paroxysmal supraventricular tachycardia. PT, patient. PT, physical therapy or prothrombin time. PTA, prior to admission, plasma thromboplastin antecedent. PTT, partial thromboplastin time. PVC, premature ventricular contraction, polyvinyl chloride. PVD, peripheral vascular disease. Q, every. RA, rheumatoid arthritis or right atrium. RAD, reactive airway disease or right axis deviation. RBC, red blood cell. RH, rhesus blood factor or rhodium. RLL, right lower lobe of the lung. RLQ, right lower quadrant of the abdomen. RN, registered nurse. RO, rule out. ROM, range of motion, rupture of membranes. RUL, right upper lobe of the lung. RUQ, right upper quadrant of the abdomen. RX, prescription. Overscore S, without. SaO2, oxygen saturation. SC, subcutaneous. SICU, surgical intensive care unit. SIDS, sudden infant death syndrome. SL, sublingual. SOB, shortness of breath. SpO2, saturation of peripheral oxygen. SNS, signs and symptoms. Stat, immediately. STD, sexually transmitted disease. STEMI, ST segment elevation, myocardial infarction. Subcut, subcutaneous. SVT, supraventricular tachycardia. SYM or SX, symptoms. T, temperature. Tab, tablet. TB, tuberculosis. TBA, to be admitted, to be announced. Tech, technician, technologist. TIA, transient ischemic attack. TID, TID, 3 times a day. TX, treatment. UA, urinalysis. UE, upper extremity. URI, upper respiratory infection. UTI, urinary tract infection. VD, venereal disease. VF, VFib, ventricular fibrillation. VRE, vancomycin-resistant enterococcus. VS, vital signs. VT or VTAC, ventricular tachycardia. W/ with. WBC, white blood cell. WMD, weapon of mass destruction. WNL, within normal limits. W/O, without. WT, weight. X overscore, except. YO or Y/O, year old.